Thank you again, Philip, and for the introduction. Thank you for joining us today, everybody. I will try to summarize where we can get some available injury data sources in today's webinar, for agricultural, fishing, and forestry related injury surveillance. Agricultural sector in the United States poses unique challenges. There are very small farms relying on the family members, and also there are very big farms relying on seasonal and migrant farm workers. The sector is the most hazardous sector in the US, and some of the farms are exempted from reporting injuries. In this webinar, I will start with some available data sources for agricultural injury surveillance. Then I will spend some time talking about the current situation in terms of agricultural and forestry fishing related injuries in the US. At the end, I will talk about specifically the situation, what's going on the state of Florida. Let's start with the injury surveillance. Injury surveillance is an ongoing and systematic data collection effort, including analysis, interpretation, and dissemination of injury information. Injury surveillance data can show us the size and characteristics of the problem areas. They describe the populations at risk and who are the people getting injured, or what specific age groups or demographics are at the risk populations. We can also learn about risk factors, what are the contributing factors associated with each type of injury, and what is the trend. With injury surveillance, we can understand the hazards, and to reduce and eliminate the risk, we can control them by interventions. We can also monitor and assess the effectiveness and the impact of those interventions. So the major goal is reducing, eliminating, and preventing the workplace injuries and incidents from happening again by looking at the data. Now we know that agricultural injury data is very important to prevent future incidents. So how can we use some available data sources for injury surveillance? There are several data sources that can be used, some of them related to fatal injuries, some of them related to non-fatal injuries. Bureau of Labor Statistics has fatal and non-fatal occupational injury databases that can be utilized for injury surveillance. OSHA has two systems. Those systems can be used for injury surveillance. There is news-based aginjurynews.org for traumatic injuries on the news. Consumer Product Safety Coalition has some sources, electronic injury surveillance system. So we can use that system to extract some agriculture-related injuries. There are also workers' compensation data and some data sources related to roadway traffic crashes. Let's look at these data sources closely and learn about how we can use those data sources and learn about their scopes and also their limitations. The first data source I'm going to talk about is the Bureau of Labor Statistics Census of Fatal Occupational Injuries. The link shown here can be used to look at the data, what they have in their webpage. CFOI covers all occupational fatalities in all US industries, and it has multiple data sources. It utilizes multiple data sources such as death certificates, workers' compensation records, and reports to regulatory agencies. Also, it uses some media reports to identify and characterize work-related injury deaths. There are some criteria for a fatality to be included in the CFOI. First of all, the fatality must have resulted from the traumatic injury, from a traumatic injury. Also, it should be occurred in United States and its territories. And finally, the fatality must be related to work. Even though the BLS C4E data is the most comprehensive and complete count of fatal injuries, there are some limitations in regarding to agricultural fatalities. First of all, the C4E does not include non-working youth, children, or bystanders who are on a farm settings killed or in an incident related to agriculture. This exclusion includes the agritourism, U-pig farms, and pumpkin patch farms events too. Additionally, roadway incidents related to farm hazards are not counted by the C4E. These are the two limitations of the system. BLS has also survey of occupational injuries and illnesses system. That database includes non-fatal occupational injuries. The injuries and illnesses to be included in the system, they have to be work-related, and they need those injuries need to require medical care beyond first aid. The SOI data excludes self-employed farmers and family members, as well as workers on farms with fewer than 10 employees. Also, it excludes private household workers, volunteers, and some federal government workers. It is estimated that by excluding those cases, the undercounting by the C4 is 78%. This is a significant number for agricultural injury surveillance. Additionally, SOI data is not available for some states, including Florida. Two data sources, SOI and C4E, they are restricted data sets, and they can be used by only researchers for only statistical purposes because of the confidentiality agreement. Let's look at the search platforms for these two data sources. The search platform can be reached by clicking this link. I am hoping Philip is sharing those links in the chat box.
Yes, so, I've been putting them in there, yeah.
Okay, thank you, Philip. So first, I'm gonna try to show you the bottom green icon here. This icon is going to show fatal occupational injuries in the US, and it's gonna show another platform to see the search screen. The search screen, it has 4 boxes. Each box can be used to filter the data based on specific need. In the top left box, you can select specific state for all US or for all US. And I selected Florida here, as you see. On the top right section, we can specify what type of search we want. And I would like to search based on the private industry, detailed private industry data. On the bottom left, we can select a category. The categories listed here can be age, demographic related, sex, gender, or race-specific related. Also, there are some categories related to event category, sources of injuries, body type, or injury sources. And I'm selecting Hispanic and Latino, foreign-born workers category, race category here. And on the right side, based on this selection, private industry selection, I can select the specific industry group for my search. So after selecting all the cases, and I can add to the selection, it's already added here. And by clicking the get data, we can see the results. It's gonna show the results web page, and you can also see the results as an Excel file. So this search results in number of fatalities in the state of Florida and in agriculture-related fatalities to the Hispanic and Latino farm workers. yearly based. Now I'm going to show you the non-fatal search button. If you click the screen, it's going to lead to another screen for search purposes. So non-fatal cases can be searched through this screen. There are this time 6 boxes. The first box is the area. You can select the area, what area you are interested in. As a note, this area does not include some of the states, including Florida. On the right one, I selected all US for as an example. On the right side, we can see the ownership. I'm going to select the private industry group here. The data type in the third box, I'm selecting number of injury and illness cases. And fourth box, I'm again interested in seeing the data by specific industry. And also I want to see musculoskeletal disorders related injuries and illnesses. So I selected that one. And then I made 2 selections. First one, we don't see it here. It was animal production. And the second one is greenhouse, nursery, and floriculture production. If I put everything here, my criteria, and get the data, I have the data in numbers. And again, you can see the results as an Excel file too. So this search shows how many people get injured in agriculture. You're in the US agriculture related to musculoskeletal disorders. OSHA is another source of data. Under the OSHA Safety and Health Act, OSHA is responsible to ensure safe and healthful working conditions for working individuals by setting and enforcing standards. OSHA covers most of the private sector employers and their employees. State and local public sector workers are also covered if a state has an approved state OSHA program. Self-employed individuals and small establishments with less than 11 employees are among the ones they are excluded from the OSHA. So that's the basic limitation. Small farms are exempted from OSHA regulations. All employers are required to notify OSHA within 8 hours of a fatality, and all incidents which are required inpatient hospitalization, amputation, or loss of an eye, they need to be reported to OSHA within 24 hours. So OSHA has 2 data systems. One is Integrated Management Information System. The other one is Severe Injury Reporting System. Let's look at those data sources closely. So OSHA investigates all cases that result in fatalities from work-related accident or any accident that involves inpatient hospitalization of 1 or more employees. The search platform can be reached by clicking this link. And it can be searchable and filterable by using some of the variables let's see in here. So again, by using some industry-specific codes, occupation codes, and region codes, we can search the investigation reports. I'm going to show an example. I want to show an example here. I'm interested in chainsaw-related injuries in the forestry and logging industry in Florida, state of Florida. So I entered a keyword, chainsaw. Industry group, I'm gonna enter 113. 113 is NAICS. It is North American Industrial Classification Code for forestry and logging. And I'm selecting the region 4. Why? Because the state of Florida is in region 4 based on OSHA's classification. So after entering these search criteria, when I click the get the results, and I'm gonna see the results page. Here is the search results. There were 20 incidents investigated in the database, which is related to the chainsaw incidents in forestry and logging industry in Region 4. As you see, we cannot just search for the state of Florida, since the Florida is included in Region 4. We need to look at each cases closely. So after these cases, it shows the summary event description, and by clicking those cases, the summary numbers, you can get more detailed information, and each one is going to show a screen like this, and some narrative data, the incident description here shown, the age of the victim, the sex, and the degree of severity of the incident. Also, if you click the inspection number, it's going to show another portal. I don't show it here, but it has some relevant information, the more detailed information related to that incident. So the IMAS data is very detailed, and it has valuable information that can be used for programming interventions and preventing those types of injuries. Other data source by OSHA is the severe injury reporting system. OSHA requires employers to report all severe work-related injuries. And those severe injuries, which require inpatient hospitalizations, amputations, and loss of an eye. The requirements started in 2015. And the data is open to everybody. It's not restricted. They can be downloaded as a CVS file, and it can be filtered for specific state and specific industry of interest. So the platform can be reached by clicking this link, and there's a download data button. If you click that one, you can download all data which is available from January 2015 till here in this case example at the end of April. So after clicking and downloading the data, if you open the data, it shows an Excel file. As I said, it can be filtered for specific dates, industries, or states. Each case has a short narrative description, as seen here. Also, if there is an inspection associated with that injury, the inspection number is shown there. So you can look at the specific inspection to get more detailed information. Another widely used data source for fatal and non-fatal agricultural injuries is aginjurynews.org. The platform, Ag Injury News, was developed by the National Farm Medicine Center, Marshfield Clinic Research Institute, located in Marshfield, Wisconsin. Ag Injury News data is publicly available. It tracks agricultural injuries through online media reports. And as I said, it has the occupational and non-occupational agricultural related injury cases. Yes, Ag Injury News is publicly available, but you have to create a register and create an account to be able to see the cases and reports in the database. And by signing up, you can sign in and see the specific data available related to agriculture, forestry, and fishing. You can use some filter options here, as shown here. You can select specific region, specific injury agents such as tractor, ATVs. And if you are interested in seeing some just fatal injuries, you can select that, and by applying the filter, you can see the results on the right section. And each case in the rows, you can click them and get more information. So I click that one, and then it shows the summary information and some incident and victim details. There is a workers' compensation data set or to use as an injury surveillance tool. Workers' compensation in the US is used for surveillance for so many years, and it covers more than 90% of wage and salary workers in the US. Workers' compensation basically provides medical and income benefits to the workers injured on the job. Workers' compensation systems are considered the most comprehensive data source. When we compare to data from the workers' compensation to the non-fatal injury survey from the BLS-SOI database, it is more comprehensive, and it has more cases than the survey of occupational injury and illnesses. The reason why, because the workers' compensation data does not have the exclusion criteria of farms with fewer than 11 employees. But the downside is that each state has different restrictions and limitations in terms of data collection and methodology. So I put a yellow box here to show the Florida case. Farm employees, they have to provide workers' compensation to the employees, but if they have fewer than 5 employees, and also if they have fewer than 12 other employees at the time of the seasonal agricultural labor, they do not have to provide workers' compensation, which is the major limitation for the workers' compensation data. Another data source is from Consumer Product Safety Commission. They have National Electronic Injury Surveillance System. The surveillance system, it includes non-fatal injury data from selected sample of hospitals in the United States, from the emergency departments. They are mostly related to consumer products, but non-product related injuries also are included in the system. The NICE data, they have the demographic variables such as age, gender, race, and ethnicity, incident dates, diagnosis, injury location, and the products involved in that injury. Also, there is a location category, which can be very valuable to extract some farm and ranch related injuries from the system. When you click this link, you can go to the query page and search for, not search, like filter the data for some years, and then you can download the data for your purposes. For roadway related agricultural injuries and fatalities, we need additional data sources. There are some data sources. The first one is by the National Highway Traffic Safety Administration. The system is called Fatality Analysis Reporting System, FARS. FARS has some data on fatal traffic crashes in the United States. Vehicle type can be used to filter to extract farm equipment related fatal injuries in the United States. So there is a specific code for farm equipment. And additionally, there is another variable, fatal injury at work. If you are specifically interested in work-related injuries, you can filter the database by clicking by selecting yes. So FARS is like national level database. It can be downloaded from their webpage. I'm not sure if I put the link there, Philip. But for roadway crashes, every state has different system. So each state has their own code book and inclusion, exclusion criteria for the roadway related injuries and fatalities. For example, as you see here, this is coming from the handbook from the Florida Department of Transportation crash database. So there are some variables can be used to extract agriculture and farm related injuries happening on roadways. So these are the all data systems available. Now, I would like to talk about the current situation, what's going on in terms of injuries and fatalities in the US. So first, I would like to look at the BLS as a data source. These graphs are based on C4 data. When we look at the left side, we can see the number of fatalities by each industry. In 2019, as you see, construction industry has the highest number of fatalities, more than 1,000 cases in 2019. In numbers, they have the biggest numbers. But on the right side, when we look at the rates instead of the just numbers, we see that agriculture, forestry, fishing, and hunting industry has the highest rate of fatality. So that meaning the rate is based on the how many hours worked in that specific industry. So it's a fair comparison of the industries by using the rate of fatal injuries. Let's look at the trend right now, looking at the specific numbers and rates of fatalities in agriculture, forestry, and fishing from 2011 to 2019. Over the 10 years, the number of fatalities, they are slightly increased, but the rate is slightly decreased. Still the change in over the 5 years, it's pretty flat. Also, I would like you to look at this little pie chart here. Most of the fatalities reported in the system, more than almost 80% of them, they are agriculture related, almost 15% related to forestry and logging, and fishing is about average 5% over the last 10 years. When we look at the non-fatal injuries, again, if we look at the just numbers, we see that in numbers, these are shown in thousands. Healthcare industry and social assistance industry has the highest number of injuries and non-fatal injuries and illnesses reported in 2019. But the agriculture, even though the number is very low, but the agriculture industry has the highest incidence rate for per 100 full-time equivalent workers. So comparisons should be made by considering the incidence rate. Let's look at the trend again for non-fatal injuries this time. We see that injury rate is decreased over the 11 years, but we need to remember that because of the exclusion criteria of the SOI, the numbers and rates probably much different than it is shown here. So I'm going to show you some findings from the NICE dataset, which is Consumer Product Safety Commission's emergency department data sets. And this electronic injury surveillance data has been analyzed for the years 2015 to 2019. And the total estimated number of the injuries, non-fatal injuries, they were more than 62,000. And on average, every year, there were 12,000 people injured in an agriculture-related incident. The yearly distribution of estimated agricultural injuries to youth and adults here shown here. This line is for adults, and the yellow one is for the youth. As you see, almost 2/3 of the injuries happening to adults, while 1/3 of the injuries, they are to youth under 18. When we look at the injury events categories, we see that transportation incidents were the most common cause of injuries. Youth had a higher proportion of transportation incidents than the adults here. Also, the interesting part is overexertion in injuries, and we can capture those injuries by the knee system, which is usually not captured by other data systems. When we look at the injury sources, we see that main leading injury source was vehicles, and this was followed by persons, plants, and animals, structures and surfaces, and tools, instruments. Adult patients had significantly higher proportions of vehicle-related injuries than youth victims, and vehicle-related injuries mostly involved tractors. And the tractor-related injuries, they were more than 20,000 injuries, accounted almost 1/3 of the injuries from the system. Now I'm going to show some results, my findings from Florida agriculture, forestry, and fishing related injuries. Over the last 18 months, I'm trying to build a database for Florida agriculture, forestry, and fishing injuries. I'm using data from death certificates, NIFS reports, aginjurynews.org, OSHA's databases, both databases, and FAR's data system for roadway-related fatalities and injuries. And by putting everything together over the last 6-year period, there were 155 fatal and 191 fatal and 214 non-fatal injuries in the system. Most of the injuries and fatalities, they were related to agriculture. And also I categorized the injured victims as workers, non-workers, and undeterminable. Workers, they include the people who were working at the time of the incidents. Non-workers include the non-working child or visitors and other occupants of the other vehicle occupants. They are injured or fatally or non-fatally injured in a roadway incident. And there was an undeterminable category, this category for used for intentional injuries such as workplace suicides and homicides. And there were some cases I didn't have enough information to categorize if the victim was working or not working at the time of the incident. When we look at the yearly changes of the injuries, the number of fatalities over the 6-year period was almost steady, with average number of fatalities each year was 32. We see a big variation in number of non-fatal injuries. In 2017, there was a farm labor transportation related roadway crash. So because of that, we see the number of injured people, injured individuals higher than the other years. When we look at the monthly distribution of injuries, we see that deaths are spread all year around. This is much different than the trend the other states, because agricultural production is happening all year round in Florida. We see all those injuries and fatal and non-fatal injuries year round. Again, when we look at the non-fatal injuries, we see a peak in April. That is because of the farm labor transportation related roadway hazard. When we map these injuries, we see that the fatalities and injuries mostly happening in the south part of Florida, as you see here. As an injury source, the vehicles, again, they are the major contributing injury sources, and mostly those categories, they include tractors and trucks. And those transportation-related incidents happened mostly. We also see 17 fatalities related to chemicals and chemical products. This was because of some substance abuse. Drug-related fatalities occurred in workplace settings. When we look at the event categories, not surprisingly, we see again transportation incidents were the most common cause of injuries and fatalities. More than half of the fatalities, they were related to transportation incidents. Transportation was followed by contact with objects and equipment and exposure to harmful substances and environments. This exposure to harmful substances environments category includes heat-related injuries, drownings, and electrocutions. When we look at the workers' compensation data, I'm going to show you the results from the Florida workers' compensation data right now. Over the last 10 years, from 2011 to 2019, there were more than 15,000 workers' compensation claims made related to agriculture, forestry, and fishing. More than 95% of the claims, they were related to agriculture, either crop production or animal production. Crop production part was the almost 2/3 of the agricultural related injuries. When we look at closely to the crop production part, we see that greenhouse, nursery, and floriculture workers had the highest number of injuries. And for the animal production, we see that cattle ranching and farming workers, they had the highest number of injuries. I tried to map the data for crop production, animal production, and forestry claims. Since the fishing-related cases, they were not too many, I decided not to put it included in this map. And each pie represents Florida counties, and the magnitude, the size of the pie is proportional to the number of injury claims. In each pie, green color represents crop production related injury claims. Orange color represents the number of animal production related injury cases. And we see here some on the panhandle, some very small number of red. Those red is related to forestry related cases. So as it can be seen, most of the crop production related cases, they were heavily distributed in southern or mid-central Florida. Animal related cases, they are seen in upper central northern part of Florida, and some forestry related cases in panhandle. So for the crop production for workers, falls and strains, they were the two main causes, common injury causes for injuries. For animal production, we see that strain or injured by category has the highest percentage. They were injured by straining or injured. There is also another category, the orange, 22% in animal production. They were animal-related cases. And forestry and logging, again, first two major cause of injuries, they were fall and strain-related cases. Additionally, motor vehicle-related incidents happened in forestry and logging industry by 19%. So in summary, so we see multiple data sources available for agricultural injury surveillance. This table is for summary what I have presented, and there's availability, some of them restricted, some of them some limitations, as all seen on the very last column here. So because of these limitations associated with each injury source, each surveillance source, I think the best should be combining all those injuries in a separate database. But doing this as a national level is very challenging because of the comparability of those systems, and they have so many different inclusion and exclusion criteria and methodological approaches. They are also different. So these multiple data sources has their own coding systems. So it makes it harder to combine everything together. In my opinion, instead of focusing on national level, we need to focus on state level efforts to combine and create a database for just to include all agricultural, forestry, and fishing related injuries. And by using those injury surveillance systems, so we can build programs and interventions to prevent those injuries. I think that's all for now. If anybody has some questions, I can get it now.
Yeah, well, thank you so much, Dr. Gorucu. I just want to remind everyone that you can use the chat box to type in your questions. If you have any questions, we have some time now to be able to take those. And so we'll give everyone just a couple minutes or just a couple moments to think about those.
Yeah, maybe this was too much information in a short time of period. But the summary is agriculture is challenging. Agriculture industry, it involves not just the workers. There are some small family farms, and people are living and visiting those farms, and different injury surveillance systems, they have some limitations. So it makes everything more challenging to build an injury surveillance system for agriculture.
Yeah, and there was one question that just came in. It says, does your statistics include H-2A workers?
I am not sure. I don't have that information. So I'm trying to gather every information available, but if there is a specific variable showing that H-2A workers, I never seen that information anywhere. If they are included in any of the data sources I listed, I'm counting on them. But I don't know how many I have in the system, or who are they, and if there are specific hazard risk factors for those groups. I don't know that. Is there any other questions? I hope I can answer this, because there is no variable identify H2A workers from the others. So I don't know how can we utilize that kind of information.
There is a comment that came in, and it says Florida has approximately 30,000 H-2A workers.
Yeah, it's significant. I'm not sure the reporting rules for H-2A workers, but for the Florida, I think it should be they should be the employers, if they have more than 12 employees in seasonal work, during the seasonal work first time, more than 30 days, they have to report those injuries regardless of their HTA situation. This is a requirement, reporting requirement by OSHA.
And then we had another question. It says, have there been any other efforts to combine injury reporting systems besides the work you have done? Are there any other organizations working on this?
Yeah, actually, everybody is like, I was in a meeting with the surveillance group this morning. Everybody is trying to bring every efforts together. How can we utilize all the surveillance systems and bring them together and to see the real big picture, what's going on in agriculture industry. NIOSH stopped collecting the survey data in 2015. So after that, every states, they are focusing on collecting and creating their own databases to see agricultural injury and agricultural, forestry and fishing related injuries. So they are trying, everybody's trying to do the same effort, but in the state of Florida, I don't think anybody else doing this kind of work to collect data to see the situation, what's going on and what are the hazards and who are at risk. And also I just put some results from the general results in this presentation, but there is more to do and hopefully I will. And also this is a dynamic process. As soon as I found some information, I include in the data, my database. So the numbers, you cannot compare these numbers, the ones I published around 6 months ago, because my database is dynamic and it has the more info every day. It's updated and hopefully I am gonna include a little more data. I don't want to see it's just I don't want to see any fatalities and injuries, but if by including it's not like closing your eyes. We should include every cases, whatever data we have in one database, and see everything to come up some ideas to prevent those kind of injuries and make maybe possible policy changes in the future. Thank you, Valentina, for asking that question.
Yeah, well, looks like there are no other questions. I actually did have maybe the final question, and then we can close things out. You mentioned that there were some limitations, of course, with the surveillance databases, and I mean, I think the comprehensive approach was phenomenal that you've taken. Did you come across any anecdotal barriers for reporting? I don't know if you touched on that or if I missed it, but anything that you just came across in doing your research?
Yeah, actually, I read some journal articles about reporting, especially those H2A workers, and because of some legal restrictions or undocumented workers, they don't want to report and they don't want to be like the person of interest to do so. And underreporting is a major issue in agricultural surveillance. That's why we need to look at all data sources and to be inclusive as much as possible. Another way of data collection might be looking at some hospital data. If the person sick in the hospital for treatment, we can look at those data and to try to get some more information, especially those are the ones who are not reporting those injuries.